113 pharmacies across Australia will begin administering COVID-19 vaccines from today in an effort to fast-track the nation's rollout. In order to prove the vaccination rates, all 3,930 community pharmacies who've been approved by the government will need to deliver the doses. Joining me live now is Pharmacy Guild President Trent Twomey. Trent, thanks so much for your time. This is great that many pharmacies are now being brought on, but what's the reality in how many doses in supply they're receiving?
So each pharmacy will receive 30 vials a fortnight, and as you know, there are 10 doses in each vial, so that's 300 doses. And that's just the starting point. Those pharmacies that go through, just like the general practices before them, those pharmacies that go through those vaccine doses at a higher rate will be able to apply to receive more, and some of them, it might last them a month. So all of the pharmacies are all very different in sizes and all very different in their patient flow. But 300 doses is the initial shipment that they'll all receive.
Okay, so is that good enough, do you think, given where we're at?
Yeah, it's not bad. The number of doses isn't a problem because the system is dynamic enough, it can gear up. I suppose the thing that we'd like to see some progress on this coming Friday at National Cabinet, and as you know, National Cabinet's meeting every Friday at the moment, is for them to remove the ban on metropolitan pharmacies. So way back on the 22nd of April, National Cabinet released a statement that said to the states and territories they can switch on pharmacies in regional, rural, remote locations, and that's exactly what we've seen from today. We only had 49 pharmacies activated in Australia yesterday. We've got 113 today, and that'll gear up to over 1,000 over the coming 4 weeks, which is great. But a quarter of the country is in lockdown, and that's in major metropolitan areas. So what we need to see now is, as you said, all 3,930, we want all of them switched on. We need to switch on all of those pharmacies in greater metropolitan Sydney. And we know that we've had great conversations with the Premier of New South Wales' office. We've had really productive conversations with Dr. Kerry Chant's office. And we just hope that those pleas to the Commonwealth Government, which have been met with quite a receptive ear. I have to give a positive shout out to Lieutenant General John Freeland, or JJ. He's doing a superb job. We met with him virtually over a week ago. We've got war games coming up with him later this week. But National Cabinet this Friday, we need them to reassess that ban on pharmacies in major metropolitan areas.
Okay, that's good to know. We'll make sure that we're looking at that come Friday. Now, you sound a lot happier than you did a couple of weeks ago, Trent. Is that fair to say? But tell me about the AstraZeneca doses, because you know, in Sydney, the risk profile has changed a lot. We know that there is a 20-year-old, a teenager, and I think it's 8 people under 35 in hospital with COVID at the moment, and they are unvaccinated because they're not yet eligible. Are you getting AstraZeneca doses there? I mean, CSL are meant to be producing 1 million a week. Is that happening?
They have been producing 1 million a week, but we're exporting millions of vaccines now for humanitarian projects overseas. And, you know, I've been critical of this, not because I'm not supportive of being the good international citizen. Of course we should be helping out our Pacific neighbours. But, you know, when you've got a humanitarian crisis at home, when you've got citizens being hospitalised, you know, I just think that Australian-made vaccines should be for Australians first, and then we help our overseas friends, you know. And so the AstraZeneca vaccine, just like the Pfizer one, is approved for 18 years of age and over. Sure, there are preferences for certain age groups for certain vaccines, but, you know, it's an individual's choice which vaccine they get. And they should be able to choose the AstraZeneca vaccine after a conversation with their nurse, their pharmacist, or their GP, and fully informed of all the risks. But, you know, it's riskier getting COVID than it is to have a vaccine. So I think we need to get them out of fridges. We need to switch on those pharmacies in those major metropolitan cities. And we need to have as many people having those 2 doses as possible.
Indeed. Trent, thanks so much for your time today. We'll speak soon.
My pleasure. Thank you.